Hello, everybody. Lisa Keslar here today on behalf of Cheers for Charity New Hampshire. And as always, I'm here with my dear friend JoAnn. Hey, JoAnn.
Hey, Lisa. Yes, JoAnn Burchuk with Lighthouse Physical Therapy and also Cheers for Charity. So happy to welcome today Lamprey Health Center. And we have Greg and Katherine here with us today. So please introduce yourselves, tell us your role, and then let's get diving into all the services you guys offer there.
Sure. Good afternoon. My name is Greg White. I'm the CEO here at Lamprey Healthcare. And with me today is Katherine Derby, our Director of Marketing, Communications, and Development. So,
yeah, what he said. That's who I am. Yeah. It's nice to be here.
That's great.
We're thrilled.
Awesome. Greg, do you want to start off? Tell us a
Sure.
little bit about the organization.
Sure. Lamprey Healthcare actually started about 50 some odd years ago in the town of Newmarket. We were originally formed as an information bureau for people who were seeking primary care in the region and were not unable to locate it. That soon developed into a transportation program as people were finding there was no care locally. From there, we built our first clinic in what is believed the Oddfellows building on downtown and Main Street, just up from Lisa's office. We moved over to Elm Street, and now we have a full service campus over next to the high school. From there, we expanded out to Raymond and into Nashua. We are a primary care provider. We're not for profit, so primary medical care, primary behavioral health care, substance use treatment. We do chronic disease management. We have largely a family medicine practice. But we do deliver babies too. So we have an OB program and a prenatal program, pediatrics, internal medicine. We have a couple specialty programs with diabetic education and hepatitis C management. And we're what's known as a federally qualified health center, which means we have federal funding that allows us to do things like sliding fee discounts, or we're what's known as a safety net provider. So while we are your town primary care physician, we're freestanding, we're not affiliated with any hospital, and we have resources to provide free care and to provide discounted care for folks who might not otherwise have the resources. So one of the things we pride ourselves on is that we provide the same high level of quality care to everyone, regardless of their ability to pay and regardless of their insurance status. So Lamprey also houses what's known as the Southern New Hampshire Area Health Education Center, which is a workforce development program originally formed to train medical interpreters. That has evolved into putting on summer camps for middle school kids to get them interested in going into nursing and into behavioral health. We also train and certify community health workers, which there seems to be quite a shortage of these days as it's become a very popular profession. We're also the host agency for the Seacoast Public Health Network, which does regional medical emergency preparedness planning. So as you might imagine, we were pretty busy during the pandemic. And we also house the Lamprey Nurse Practitioner Fellowship, which is a postgraduate year of training that new graduate nurse practitioners come to work for us. They are fully licensed, but they have an opportunity to have perhaps a smaller panel to kind of get their feet wet in primary care and to have some exposure to some of the specialties in the community to help kind of guide their experience and to kind of build their practice. So we're oftentimes workforce is hard to come by. We try to make our own.
Yeah. Holy cow. I'm glad we're having this conversation today because I'm guessing by the long list of things you just listed there today, there's a lot of people in our community that don't realize all of the various programs and specialties that you guys have there, which is fantastic. Can you repeat again which towns do you actually have physical centers in?
So we have a physical full size campus in Newmarket, in Raymond, and in Nashua. Okay. So we actually have some rural settings like Newmarket and Raymond, and an urban setting in Nashua. So we're very different in Nashua. A lot of our patients are new to the country. They don't speak English. A lot of very cultural differences, where over in the Seacoast area with Newmarket and Raymond, our patient panels tend to reflect the communities that we live in. So
we also have a mobile health services. right?
Wow.
So mobile health services, it's a van that is fully equipped, and we are able to see patients on the van, and that has regular stops in some communities that would where people would not otherwise be able to receive care, such as Deerfield and Milford, and it makes several stops in Nashua at a lot of different shelters, including the Nashua Soup Kitchen and Shelter.
Oh, that's wonderful. And people know that you're going to be at a certain place, like that's
right. Yeah.
That's
So
actually
same
part of the
schedule
plan.
every week.
yeah.
Yeah.
Oh, that's wonderful. Healthcare access for everyone, right? As it should
Exactly.
be.
Yeah.
Yeah. That's fantastic. And so you guys are a nonprofit as well. So do you want to share a little bit about that and how
Sure. So we are a nonprofit, as you said. We have, like I said, funding from the state. We have funding from the federal government. We do a little bit of fundraising, not a lot. Typically, our activity is funded by a series of grants and contracts, as well as what we're able to bill, say, Medicaid and Medicare. One of the interesting things about Lamprey and our federal designation is that our governing structure, our board, is consumer dominated, meaning more than half of our board members are actually consumers of services at Lamprey Healthcare. So, and we have representation from all three regions that we operate in. So, a very diverse set of viewpoints, a lot of very committed people. It's always nice to have folks in the community volunteering for our board, as well as our patients, and in some cases, they're both.
Yeah, that does sound very unique. What things are you looking for from the community? Or what are things that you feel that maybe some of the programs that you mentioned that people just don't know about, and if they could take advantage of?
Well, certainly, I think the whole industry of healthcare these days is a little stretched for a workforce. So we would love to say yes. I would like us to folks to look us up to be their primary care provider. Obviously, we're strained a little like everyone else in terms of supporting staff, but the doors are open. I think a lot of folks don't realize, I think a lot of folks in Newmarket in particular know we're here. They've been with us for a long time, but don't realize we offer a sliding discount, or that we do substance use treatment, or that we have a hepatitis C treatment program, or that we offer discounted medications. Because of our federal status, we're able to procure medication at a very, very low rate, and are able to convey those savings on to folks that are eligible based on the sliding fee scale. Beyond that, certainly, engaging the community, knowing we're here, volunteering for the board. We've not typically had a lot of volunteer opportunities, but that is going to change as we kind of add programming. Again, just being connected to the community, I think, is my biggest priority, and having ties to businesses downtown like yours, and knowing folks, so that when we come by, or they come by to see us, we know who you are, and how can we help you.
Yeah. Kind of like Cheers.
Right.
Pretty much.
Right.
Yeah.
I
We
think
also have a navigator that I want to let people know about, because this is a really unique service, and you don't have to be a patient at Lamprey to use that particular service. If you let's say that you recently lost your job and you're wondering, what am I going to do about healthcare? You can come and talk to our navigator, and they will sit down with you and talk to you about all of the different options that are available out there through the marketplace, and that is coming up soon. So I just wanted to give a little shout out to that. So anyone who's looking for advice on what they should receive for coverage, they can come and talk to our navigator.
that's huge. And I would think the other thing, didn't we talk about, like, anybody can go to you as a
Yes.
patient? I think people sort of think it's only for a certain subcategory of people, but you'll take anybody who needs treatment, correct?
Well, like I said, that is a true statement, and I think it's a misperception that you have to come here because, or you can't come here if. We are a community primary care provider. I would say we're contracted with just about every commercial insurer in the state. We take Medicaid, we take Medicare, Anthem, Harvard Pilgrim, I don't know that there's any differentiating factor. And kind of when I talk about our mission and orientation, it's like, accepting people care without regard to their ability to pay is kind of a broad statement, and doesn't just mean we only serve those without insurance. That we serve everybody, because folks have different barriers or different challenges in life. Your primary language might not be English, or you might not have transportation, or any other number of the communities that you belong to that might face barriers or difficulties accessing appropriate care. So
Yeah. Good. Can you just speak a little bit about the transportation? How does that work?
well, in years past we had a bus, but that kind of got to be a problem during the pandemic. So what we do now is we work with local transportation networks, typically volunteer networks. We also have vouchers for certain taxi companies, and I think there are some that specialize in medical transportation. So sometimes what happens is, we'll refer a patient for a procedure or say a minor surgery, but they have no way to get home. So we arrange for special transportation for them to get home, because you can't drive yourself home after some of these things.
Mhm.
Oftentimes just getting to care can be a problem, particularly in rural communities. There's no bus routes. There's very little available in terms of taxis or, say, Uber. We don't see a lot of that. With the pandemic, the advent of telehealth really helped us with a lot of that. But we do find that there are subsets of our patient panels that maybe have not adapted to telehealth
Mhm.
easily, and not all services are necessarily appropriate for a virtual visit. So.
Fantastic. Is there anything from the community, any sort of asks that you would love to have, whether it be resources, volunteers, I don't know, anything?
Well, certainly resources are always appreciated. We like to dedicate those sorts of charitable giving and philanthropic things to things that benefit our patients directly. So we have some internal patient assistance funds. So where we don't have a dental program, for example, we might find some resources to help people pay for a dental bill, because we truly view healthcare as very broad. It's not just healthcare. It's your mental health, it's oral health, your eyes, your feet, things like that. So that's those sorts of fundraising opportunities we dedicate towards things that really help patients directly. Certainly always looking for folks that might be interested in serving on our board. We don't have a lot of fundraisers, but we will. We're having a gala coming up next month in Derry to celebrate kind of our another year. We've had a pretty eventful year in terms of a couple of construction projects, a frozen pipe event in Newmarket, and a new electronic medical record. So not to say I would ever have done all of those together at the same time on purpose, but here we are.
Fantastic.
Life
guys
throws us challenges.
Yeah, it does.
You guys have such a good reputation. Like, now that my work home is in Newmarket, just, you mentioned Lamprey, and people just have such positive things to say and such good experiences. But I do feel like it's a bit of a hidden gem. It's another one of those things that people who know about it are really happy, and then there's people who just have no clue.
Yeah, that's unfortunately we're not unusual for organizations like ours to be something of a well-kept secret. So we're endeavoring to change that. So and Katherine's out in front of that quite a bit.
That's fantastic, right? So I'm so glad that we can do a little smidge of a part in helping with that, because everyone needs to know that you're really that local neighborhood resource for
We're
good
very
quality
grateful for that.
care. Very quality. And that I've been in the building. It was a little bit back, but it's lovely in there. It's a really nice place.
It's back to lovely now too, after having been a little wet last February. So we just reopened.
Oh, good. Okay. So so we're ready to see people, ready for people who need to come in.
Very
You're,
much so.
you're very close to the school, so you're very close to downtown.
We are. It's like I said, we've had a couple of locations in Newmarket. We started out on Main Street. We have still our finance offices over on Elm Street. And we do have our campus, as it were, in Newmarket, where we house not only a clinical operation, but most of our administrative operations as well. So
Fantastic. So good. So we are so glad that you took a few minutes today to have this conversation with us, and that we're able to spend time. Thank you both for getting involved. If people want to know more, what's the best way for them to check you guys out, get more information if they're a potential pet, patient, if they're maybe someone who wants to support in the community, any of that stuff? What's the best way for them to get more information?
Katherine? Oh, Rosen. Check out our
Right.
website.
Oh,
There-
www.lampreyhealth.org.
There you go.
There you go.
Love it. Awesome. Well, thank you so much for being with us today. We really appreciate it.
Well, thank you for your time too. We really appreciate the engagement.
Fantastic.